Hi, I'm Allie Ferraro, and I'll be answering questions on VideoAmp based on blood pressure. So number one, is there a difference with the position of the earbuds? The positioning of the earbuds will not have an effect on the ability to hear the heart rate. However, it is always recommended that the earbuds face forward such that it makes a nose shape form. Number two, what is the other head of the stethoscope used for? The other head of the stethoscope is called the bell. This is used for low frequency sounds such as murmurs that is associated with bowel movements. Number three, list 3 reasons for selecting the left arm instead. And how different would the blood pressure be on the left arm versus the right arm? So one reason for selecting the left arm could be for its consistency in measuring. You should always use the same side for everything in measurements. Also, maybe the right arm might have had surgery recently or is injured that could affect the blood flow in that arm. And lastly, primarily your heart is on your left side, making measurements more accurate and efficient for hearing purposes. So ultimately, blood pressure in the left arm versus the right arm should be consistent in measurement. Drastic differences in blood pressure between the two arms could suggest further health issues for that patient. So number 4, what if you can't find the pulse right away? Can you measure the blood pressure anyway? If you cannot find the pulse right away, do not panic because that always happens to me. You can still measure the blood pressure anyways because it is more likely you will hear the pulse when you begin to fill the cuff with air and gently release it. If you still cannot hear the pulse, either switch arms or consult with them if they have any health concerns you should be aware of. Number 5, list 1 reason to pump up the cuff below or above 200. Pumping up the cuff to 200 is an effective way in determining accurate blood pressure numbers. It gives you time to release the air in the cuff to read the systolic and diastolic blood pressure readings. So you should read systolic around 120 and diastolic should end by 80. It is crucial to pump below 200 in case the subject has low blood pressure, and it is crucial to pump above 200 if the subject has high blood pressure or is hypertensive or is exercising. So number 6, what is the impact of going too fast or too slow? The impact of going too fast or too slow is you may have difficulty in hearing and in reading the pulse and the dial reading. Going too fast makes it hard to catch the systolic and diastolic readings. And going too slow may be uncomfortable for the patient, being too tight, and it could also give you inaccurate readings. So going at a medium speed is beneficial to obtain those accurate results. So in the video, they referred to number 7 as what is the thump. The thump describes is the first heartbeat, which is the systolic blood pressure. This is where the heart contracts and pumps blood. This is the highest pressure and should be at around 120. Number 8, what is the last thump? The last thump is the diastolic blood pressure. This is not where the heart rate is at rest. That's what most people get confused about. This is where the blood fills in the heart. This thump should be around 80. Number 9, which variable is more reliable, sight or sound? The variables sight and sound are both used effectively. Although hearing is crucial because that is where you determine where the systolic and diastolic number is read. In this case, seeing is crucial when observing the dial. It will move back and forth around the diastolic and systolic readings, but both of them work together. However, I believe sight is more reliable for results. You need to hear the thump in order to record the dial number. Therefore, they both work together. You must hear and then you see. Number 10, what are the normal limits for blood pressure? Would blood pressure of 80/60 be normal for some individuals? Normal blood pressure reading is around 120 over 80. A blood pressure of 80 over 60, however, is highly associated with aerobic, athletic individuals. However, if you see that in a normal, non athletic individual, then that could pose some health concerns and it's highly abnormal. Number 11, what has contracted specifically? What is contracted specifically is the ventricles of the heart, known as ventricular contraction. The left ventricle has contracted to pump the blood out of the heart and out to the rest of the body where it is most needed. Number 12, is the second beat the diastolic blood pressure? Yes, the last thump heard is known as the diastolic blood pressure, and this is again where the heart fills with blood. And that is all for the questions, so thank you.